What is overlooked in discussions on hair transplants? And that can include technical factors or emotional considerations to make for patients.
Essentially, people are under the belief that hair transplant is very easy and it's kind of a cookie cutter type of procedure whereby you can just go anywhere and have the procedure done. Would you agree? That's the thought process. And in reality, it's like there's only a handful of clinics, realistically speaking, given the number of clinics out there, that actually do perform surgery in the way that it should be, in light of the naturalness, the ethics, the way that the patient is looked after for the long term. Is a real misunderstanding or lack of education that patients have around hair transplantation.
Yeah, I think the donor management is a big thing as well that patients don't fully understand. And I one of the things that really bugs me is this where I see these patients, they go off overseas or even in the UK, and they really put so many grafts into the hairline for somebody who's got like a Norwood 6 pattern, and then they put a few grafts into the crown and they completely miss out the mid-scalp. So they've set this patient up for this series of ongoing procedures. Yeah, totally to fail. Yeah, and whether they're on medication or not. But I keep seeing it on forums such as Reddit.
But that's where they're not being guided ethically and appropriately, and this is why it's so important to, if you're going to elect to have surgery, that you're guided well by a clinic that's going to look after you for the long term. Because like we both know, we've known each other many years, collectively had probably more than 20 hair transplants, and we
21, I think.
Yeah,
if you've had 13 and I've had 8, I can do the maths on that.
We know that this process is not a quick fix.
Yeah.
Well, it is a long-term kind of process, and a long-term management process alongside kind of getting on proven medical therapy to prevent further loss. Because I think that patients, that are interested in getting a hair transplant essentially think that it's just a quick fix. They don't realise that it doesn't stop the progressive nature of hair loss, and if you don't intervene and combine it with good ethical hair hair restoration, they're going to come undone at some point down the line.
I think that's the problem, is that people rush into having a hair transplant at a very young age, or they just don't do their research. So they're attracted by discounted procedures, Black Friday offers, unlimited grafts, all of these things, and they're not doing their due diligence when it comes to understanding the process. And they don't understand they have this limited supply of donor hair. And I've talked about this so many times recently, where patients are going off having a big procedures done, 4,000 to 5,000 grafts, and depleting their donor in one foul swoop. But even these smaller procedures can deplete your donor area.
No, definitely. You touched on a point there about kind of affordability and patients wanting to have a hair transplant, and they're being guided by the price point. And this is why we've both seen, working in this space as patient advocates, the number of patients that we speak to that retrospectively didn't do their research and they bought into like an Instagram advert because of the price, and they've flown off to the Turkey, for instance, the whole medical tourism aspect that has reeled them in and not given them the proper education.
What advice would you offer for someone in the early stages of hair loss looking to have a transplant?
Our roles have been over the last 15, 20 years of trying to get that message across, that if you're going to elect to have surgery, you've got to make sure that you do your due diligence and understand what sets clinics apart from others. And we both work with very reputable clinics around the world, and we're here today at the Harley Street Hair Clinic because we believe in I personally had surgery with the Harley Street Hair Clinic, and for me it's clinics that educate their patients and make them truly understand what they're embarking on is the clinic that people that are interested in hair restoration need to know about, so they can go and get an accurate, honest consultation about their eligibility, because like we know, a lot of patients that have surgery aren't even eligible for surgery.
Yeah, that's very true. But I think talking about the putting price first is such a dangerous thing. Because you have a poor surgery, you'll pay 4 times as much as what your original surgery will be to get repaired.
100%.
One, bad, cheap hair transplant then takes, usually, in my experience, and I've dealt with lots of repair patients over the years, being a repair patient myself, probably 3 procedures to put that one procedure right, and then you'll end up paying the expertise of somebody who is, who you'll seek as a repair patient, and you'll end up spending probably, as I say, 3 times the cost.
And the limitations that brings.
Yeah.
When if you'd have gone to a reputable clinic, the cost may have been slightly more, but you would have got a much better result and had options further down the line for further surgery, and had a much more long-term game plan put in place for you, and managing that donor supply alongside it. So the repercussions of electing for cheaper surgery are very costly in the long run.
Yeah, well, we both know that ourselves. So you were saying earlier on that you had 4 procedures, I think, before you got things right?
Yeah, I had 4 strip procedures with Bosley in New York at the age, all very much back to back over a very short period of time. I think, relatively speaking, within the space of a year to 18 months, I'd had 4 strip surgeries, and all for 500 grafts each time. So 4 strip surgeries for 2,000 grafts. That's what they told me, it was 2,000 grafts.
Yeah. What year was this?
2004.
Okay.
All on the bounce. And then all my surgeries subsequently after that. I mean, the irony, we met on the forums over however many years ago. But I'd
20 years ago.
Referred to the forums at that point, which the dawn of the internet, when I first started out, I was looking for hair transplant surgery in the yellow pages. And my story's been well told, but I saw Bosley on a Super Bowl advert in America. And, it was only at that point then that I realized that I'd messed up, because the results just weren't natural. So I had then had to do my due diligence. And luckily for us, it was the internet had fired up. And at that point then, kind of jumped out of the frying pan into the fire, but my journey's kind of been well told in the media, and it's been well documented. My last procedure was here at the Harley Street Hair Clinic about four years ago now.
What questions should prospective patients ask from your experience, and some of the things they should actually watch out for when looking for a hair transplant?
I had my procedure just around the corner from here. And my research, well, actually, I was referred to by a trichologist I used to go and see at the time. But the only way that you could look at hair transplant surgeons was to look in the back of a magazine at the time, and you just went along. There wasn't the option. So I think patients have got it. Well, it's a double-edged sword, because patients have got so much choice today. Then they can become like a rabbit in headlights, because you go online, you read about this clinic, you listen to such and such an influencer, you get led to that clinic, and I think it's really difficult for patients to be able to fully understand, who is doing good work and what they should look out for.
In your opinion, what distinguishes a great transplant from a subpar one?
My thing's always about naturalness. That's first and foremost. It's look at the hairlines. When clinics show you their before and after pictures, how much focus is on the hairline. That for me is the thing that patients should be looking at.
What questions should prospective patients ask from your experience, and some of the things they should actually watch out for when looking for a hair transplant?
Hair loss sufferers today have got, for all intents and purposes, too much choice, because they go, let's face it, they don't necessarily go to websites. It's all very much social media based. The algorithm can catch them once they click on, a clinic here or a clinic there, or anything hair loss related. And sadly, they're then kind of fed this information whereby they are then influenced by influencers. And we have seen it firsthand.
Yeah.
I mean, we were classed as influencers before it was kind of a buzzword.
Yeah,
Like we were helping on the forums, in the trenches, you know, helping guide people based on our own experiences. But I think what's really important is people realize that these influencers that are out there are essentially trying to persuade patients to have surgery because they get commissioned. If those patients then go and have surgery, they haven't got an interest in their well-being or the patient's outcome. It's just a numbers game, and I think it's something we've both seen as a result of being patients ourselves, both repair patients, and being in this industry for so long, how transparent it is.
Yeah, you can spot it a mile off, can't you, really, in terms of like who are the genuine people within this industry. But that's because we've got the experience of 20 plus years to be able to spot these things. But I think it's so difficult for somebody now looking for a hair transplant as to where do they start, because you know, you'll go on social media and you'll see somebody who's just straight out of surgery. He's got his hairline there and he's thumbs up, you know, this is the place to go to, you know, come here, what amazing service I had. They put me up in a
arm round the doctor.
They put me up in a 5-star hotel, and they you know, I got the accommodation. They picked me up from the airport. I got all this food thrown in as well, and I think that can be really attractive to patients, but they need to look beyond that.
It's interesting though how people who are researching hair transplants or wanting a hair transplant are governed by what else they get thrown in on top. And an analogy I've always kind of used is like, if you're going to research, you know, you need to get a heart transplant, you'd spend more than a few hours and go to somebody that's got, you know, a few positive comments on an Instagram channel.
But people are drawn in by these buzzwords, aren't they, at the moment? So it's like DHI and Sapphire, and people think that it's something special, that it's going to make the big difference. It's going to give them an extra edge on terms of their results, but it doesn't. You know, it's DHI, FUE, it's the same thing.
100%. You take. What about the, you know, over recent years, the robot? How we saw that one coming, and then now we're seeing the results of that, which you know, we're here today at the Harley Street Hair Clinic. We've actually seen a patient who's you know, having to get repaired after having surgery via the robot, and it's our role, I feel, is as important now as ever because of the sheer volume of misinformation that is out there and being churned out on such a daily basis. We can only do so much. We can only kind of draw attention to clinics like the Harley Street Hair Clinic, but we need to try and make sure that this education and people get educated so that they can make their own decisions. You know, it's not necessarily that they have to go to X, Y, or Z clinic, but at least do your due diligence and at least understand this is surgery. You're going under the knife, you know, it's not just like an outpatient procedure and you're getting a filling. You've got to really understand what you're embarking on.
Yeah, I think some people just treat it, as you say, like I guess they think it's just a minor procedure, but they don't think about the long-term implications of that. What is effectively a minor procedure is that this is going to stay front and foremost on your forehead for the rest of your days. And if you get it wrong, then you're seeking multiple repair procedures, or you're wearing a hat, or you're wearing, you know, lots of fibers and so on to cover up that mistake that you made. And we both know that ourselves, having been there.
How can patient advocates like yourselves improve transparency for patients around procedure costs and planning and post-op recovery and expectations?
For me, and a lot of inquiries I've had of late are younger guys who have said to me that I'm not going to be worried about it when I'm 35. And we both got our surgeries in the early 20s, you know, when I was early 20s, you were 20, we're like 50 now, and it still bothers us as much as it did then.
But I said that myself, you know, I remember going for treatments and I was thinking, if I could get to 30 with a decent head of hair, then after that I won't care, because I'll be married, I'll be settled down, and I'll
be old.
Yeah, I'll be old.
It won't matter.
Well, because when you're 20s, you think 30 is ancient.
Oh, yeah.
And then when you're in your 30s, you think 50 is ancient. And then now I'm thinking that 70 is ancient.
Yeah.
So, yeah. But we do, it's that kind of you only live once type of attitude that people have. And I don't know always when you're in your very early 20s whether you're mature enough to make these kind of decisions. I know looking back that I certainly wasn't. I rushed into making such a quick decision based on a recommendation from a person. That was enough. And people are doing exactly the same. They're going on social media, they're seeing this recommendation, they're thinking he's had a great result, or even a friend, for instance, so or a colleague at work. A colleague at work, this is a classic one you hear all the time. He went off to Turkey and he had a great result. And I've gone there now. But the variables of what you're going to get compared to your colleague, because you'll meet the doctor, he'll draw the hairline, you'll be whisked off into a room, and you might have a completely different team working on you than what your friend did. There is no way of guaranteeing the results. So for me, choosing a clinic is about finding consistency of results, but also consistency in the team, finding a clinic that has the same team in terms of the technicians, that doesn't have freelancers coming in where you can't control these aspects of the procedure.
Traveling techs.
Yeah, traveling techs, people, freelance techs who come in, they work from clinic to clinic, they don't have any responsibility to that clinic at all.
They're not being trained by that clinic.
No, exactly, you're not being trained, and often that's the thing, is to set up a clinic and then train your staff the way that you want to and retain those staff. I think that's a skill.
That's hard.
Yeah, it's hard work.
It's very difficult, and it requires an incredible amount of investment and passion and time by the individuals that set that up. But it's this traveling tech thing is a real issue, because people, we've heard different doctors have technicians, the high turnover, they come with bad habits, or it's not in the same ethos as even the doctor wants to perform, and therefore the results are going to vary. And we see it so many times. It's so difficult for us to relay all our knowledge in quick conversations with people when they're on the phone shopping around for hair transplant clinics.
But that is one of the things that people do not think about in terms of the variable. Is in terms
well, how could they know that?
Because they don't think about that. They don't think about, well, actually, who's going to be assisting me? Who's going to be doing what on the course of the day? How much doctor involvement is there going to be?
So many layers to it.
And then, what's the experience of the technicians? Have I got, the newbie who's sort of like, because the main technician's off sick or whatever, and they're going to bring in, I've even heard people bringing in the receptionist. In the
or the
past,
cleaner.
Yeah, why not?
Yeah, well, there's been you laugh, but I've heard it. But this is a really key point that you lead into, and this is why it's so vital that it is a surgeon performing the surgery who is. It's vital that any person that is researching hair transplants knows that it's the surgeon, and they have the opportunity to speak with the surgeon and discuss the plan, and not meet with just a consultant. Consultants have their place, but
absolutely. I was one for 15 years, so they
especially informed and educated and ethical consultants. But what is vital is that people understand that it is a surgeon and a doctor that needs to be in complete control, along with the patient, of understanding the patient's goals, their expectations, because expectations is such a vital thing, and the doctor can hopefully keep those in check with regards to what that patient's bringing to the table, because we know every single patient is unique with all their own different variables. And that's if they're a virgin scout, never mind if they're a repair patient.
What you were saying about the having consultation with the doctor, I think is so important. And making sure that you have that consultation in advance of your surgery date. You need to speak to the doctor. I don't care whether it's in person or it's on Zoom, but you need to have that face-to-face with the doctor to understand that they're on the same page with you. I think what's really dangerous is where you've just had the consultation with the patient advisor, consultant, whatever you want to call them, and they may have a slightly different idea, based on what the doctor is, and then the doctor's under pressure when you arrive on that day, having not met the doctor, having not had that plan with them,
100%.
to go ahead and have the procedure. You may be a bad candidate, you may not need as many grafts, all of those types of things. So it's so important that you sit down and have that conversation with the doctor.
Definitely. It's a really key point, because I know, having a hair transplant here at the Harley Street Hair Clinic, the doctor came in and we discussed it, and I know that whenever there's a consultation, the doctor is involved. The patient doesn't leave not having met the doctor, especially if they've got questions. And anybody that's intending to get a hair transplant, if they haven't met or spoken to, but they have to have met them, but then subsequently then spoken to them after if they've got any questions, then you need to question the integrity of that clinic. So these are simple, obvious.
Well, it's obvious to us.
It is,
but it's not obvious to
necessarily
everybody.
Obvious to somebody that's just decided, I'm thinking of getting a hair transplant.
No, I totally agree. But talking about thinking of getting a hair transplant, your hair looks amazing.
It's very kind. I've had 13 hair transplants, Dave.
Well, I would expect it to look amazing after 13. Well, but is there any more in the bank? Is there any more? You know, is there? Is there any more in the bank? That's a really good question. And it's something I get asked all the time. It's like, how can you have had 13 hair transplants and still have all that donor supply, what appears to be? Because,
you know, however, I think there's a lot of scar, surgery creates scar tissue. And after having so many surgeries, I definitely know I've got a very limited amount left. That's why I'm so kind of pro kind of intervention and medical therapy to prevent further loss. And this is something that patients need to be fully aware of. Essentially that's been the secret to my success, is finasteride. And then I was on finasteride for 10 plus years, and then I moved to dutasteride. So because of as an insurance policy as a stronger DHT inhibitor, because I couldn't run the risk of losing any more ground, especially in light of using so many grafts at the front.
Well, I think that's the thing. I think that it's important if you're losing your hair to get on medication such as finasteride and minoxidil, but it's even more important once you've had a hair transplant. When did you jump on finasteride? How many years ago was that?
Oh, well, I got onto finasteride relatively early on, after about my 4th hair transplant with Bosley, and I've been on it ever since. I sadly got on it too late, because too much had gone. And it's something that, people watching this understand, that actually prevention is the cure. If you can intervene early, and any patient, in my opinion, and any ethical clinical advice, getting on a regime prior to a hair transplant could actually prevent you from having to have a hair transplant. And I know it's something that the Harley Street Hair Clinic here are big advocates of helping patients get educated around preventing further loss, because the more hair that you can essentially keep, the fewer hair transplants you're going to have. But I've spoken to countless patients that have wanted to get a hair transplant. We've got them educated and got them on proven treatments, and it's prevented them from actually having to have a hair transplant because they've responded so well.
I've seen it so many times over the years where patients will come in, they're determined to get a hair transplant, but you educate them in terms of their options, and maybe that's not the best thing for them at that particular time, and they go off and they do medication for 6 to 12 months, and they actually don't need the hair transplant. And that can sometimes, stave off the need for a hair transplant for years.
If not, period. You may not necessarily have to get a hair transplant. And that all boils down again to expectations and what the personal goal is.